about done.
Okay. You'll notice we're about 10 minutes late, and I'm sorry, that is my fault. We had started this out, and it started streaming on the church's site, Jerusalem Community Baptist Church. Welcome to Hope for Hale Center. We're going to today have another one of our live news conferences to address some of the issues concerning COVID-19, the coronavirus, and its impact specifically on Hale Center, our businesses and our churches. And to get into that, we'll be talking with a nurse from Covenant Hospital, Jack McCaslin, the director of Hale County Health Department. And to head this whole thing up and to get it started, we welcome in the mayor of Hale Center, W.H. Johnson. W.H.? He's not the director. I'm not the director. You sure look like the director.
Thank you, Terry. As per Hale County Health Department, there are 7 cases and 2 recoveries and 2 deaths in our community. And I would love to see that number become zero, none at all. And I went by and I talked to Judge Mull this morning, and they do have a mobile test collection. It's coming to the community, and it is May the 2nd. And you have to have the symptoms of some type of the coronavirus. The fever, all the whole works. I'm just going to go through it. And then the number for this is 512-883-2400. And they'll give you the information that you need, that you help you to require to do that testing. Let's continue to wash our hands, use sanitizer, and keep social distance of 6 feet. Disinfect and wear our masks. And as per Governor Abbott, session ordered our restaurants, retail stores, and churches are given the choice to open on Friday, May the 1st. And I'm not going to say a whole lot on it because I think I'm going to let my health director kind of speak on that behalf because I know some, but I don't know all. So we're going to let him go over that because there's guidelines and that type, and he knows a lot more than what I know. Now, more than ever, we need to take responsibility for our actions. Not only do we need to watch out for ourselves, we are also responsible for the well-being of others. As information from the Hale County Health Department is updated, the City of Hale Center website will be updating as information is shared. As per Hale County, we are still sheltered in today. Tomorrow, I talked to Judge Mull on this too. It's going to be open, but right now it's still sheltered in. But whenever they give that permission to everything is open, then we can just go from there. But right now, and that might happen today, they meeting today, so it could happen tomorrow. But we'll try to put that on the website too, so that everybody would have an idea on that part. And let's continue to focus on our community, senior citizens, or seniors, 65 and older. I'm asking for everyone to help to control this virus in our small community. I would like to see everyone with masks, from children to adults, if you must leave your home. I also want to thank those citizens who continue to help our community and our seniors. Let's be safe, let's protect ourselves, and the great citizens of Hale Center. And God bless, and I'm going to introduce Jack McCaslin and Rachel. If y'all please come on up, and we'll have them there to give some information and that. We'll kind of do it that way.
Okay, my name is Jack McCaslin. I'm the Plainview Hale County Health Inspector. My official title is actually Environmental Health Inspector. I am not the director. I just haven't want to put that out there. WH wanted me to talk a little bit about HIPAA rules, and then we're going to touch on some of the new regulations. First of all, on the HIPAA, I mean, there are things that we can say and things we cannot say. We cannot give out any personal information on anybody. In other words, I cannot tell you who is actually sick, anything like that. I am required by law to put these addresses in the dispatchers so they know if they're going to go there. Beyond that, though, and the minute they get off of monitoring, they come off, and they can't keep those. So that's all I'm going to say that. If you have specific questions about HIPAA, you can call my office. We're going to touch base a little bit about reopening for restaurants and churches. On the churches, it's 25% of total capacity. No more than 6 people on a pew. You cannot have, if you live in one family, you can go one family per pew. But if you live in the same household, you must skip every other pew. They really encourage the high-risk people to stay home because they are high risk and that we don't want to put them at risk. If you cannot do that, they have to go to church. They at least try to do a section of their own. As far as restaurants are concerned, you are allowed 6 people at a table, family groups, and you must still maintain 6 feet between tables, between parties. And even including in the waiting line, you have to maintain 6 feet. So it's not business as usual. I know West Texas, we love to have these big family get-togethers after church. We cannot do that, okay? You can't bring 5 families from 5 households in at one table. We're just not going to allow that. As far as masks are concerned, and I'm sorry about this mask, I wore this one to show that you don't have to wear the surgical mask. That's not a problem. A simple cloth mask will work. The masks are more to protect other people than you because it's a droplet spread. So if it's catching everything, then you are not the one that's spreading. And you're going like, well, I'm healthy, I'm well, I'm not spreading. Problem is, we have a lot of people who are asymptomatic. In other words, they do not have any symptoms at all. And this is our biggest spread. People who feel wonderful, but they have actually gotten it, their immune system's fighting it off, but for a brief time, they are the spreaders, and they never know it. So this is to protect other people. So you wear the mask to protect all your other loved ones. Thank you. I'll let Rachel talk.
Hi, my name's Rachel. I'm actually a nurse at Covenant Hospital Plainview, but I'm here just as a nurse of the community of Hale Center. I do live here in Hale Center, and the only thing I wanted to bring up is the social gathering. Because I do live in Hale Center, on the weekends I see homes with cars lined up on the streets and people cooking out in the front yards and in the backyards, and this is not what we're supposed to be doing at this time. And I know that, I have a large family. I want my sister to come down from Lubbock, and it's very hard for me my kids not to see their cousins. But we really need to just stay away. I don't want to say stay away, but you can FaceTime, you can do those things. But I think the biggest reason we're seeing such an increase in Hale Center is because our social gatherings have not stopped. And this is one of the biggest ways to spread this virus. So that's about all I have to say about of that.
I did have one more thing about social gatherings. I have seen the rules that they're going to come out. Or I haven't seen the rules, but I was in a meeting with them yesterday. Plainview, and I believe Hale County too, I believe that's what the judge said, they are going to limit the gathering to 10 people still. So even if you're gonna have a gathering, it is still limited to 10 people, and they still want you to maintain the 6 feet. So this doesn't mean we're gonna go have a quinceanera down here, or Joe's birthday party. It still keeps it 10 people. Always, always, always remember, respect and protect our high-risk people. So that's why we want to keep this thing down. Thank you.
Thank you, Jack and Rachel. I want to bring in Reverend Knipper from the Baptist Church, First Baptist Church. All right.
All right, thank you for having this time where we can share. I did want to speak to the issues surrounding houses of worship. I actually referencing documents that are put out by our governor and everybody, and it does speak to the matters that our health professionals have told us about. Specifically, it's reminded us of the encouragement of those folks that find themselves in categories either listed as high risk or 65 and older to continue to be a part of their church remotely during the interim period until there seems to be an established time where we can see that we're completely on top of this COVID-19 crisis that we continue to navigate. I'm saying that also because I want you to be aware of that even though the laws are suggesting that churches reopen, there's no criticism for a local church that may make the decision to either not do that initially or to do it in an incremental way where maybe they work toward getting back to the building but not going back as life as normal before times. So I want to share that with you to encourage us all to continue to be vigilant and to continue to be patient and enduring, because I believe that the Lord will reward our diligence and endurance with His protection. And so I wanted to make that known to you specifically. Regarding First Baptist Church, we want to also make it known that the services that we provide the community through the South Plains Food Bank initiative will continue to be happening during this time. The first coming Thursday of May, we will have our food distribution for all folks who are eligible to receive those food boxes, and their eligibility has been determined that they meet that criteria by the South Plains Food Bank. That distribution will be happening the first Thursday of May at the normal time around 10 a.m. in our east parking lot. As far as our worship gatherings go at First Baptist, our deacon leadership has determined that we're going to take an incremental approach to it, where we're going to continue to do our remote setting of technology-based worship gatherings. And then we may put together an event where we'll do something like a drive-through special recognition or award or honor time in the coming weeks. We'll unveil that information as we have it more ready. But that's going to be contingent upon two factors. One, our technological abilities continuing to advance. And two, what happens with our continued results with combating the sickness. So it's going to very much be for us a week-by-week determination. And we want to encourage everybody, whether a part of our church or any other church, stay connected to your congregation electronically, and then be patient as we wait upon the Lord to bring us back to our physical locations together. WH, I'll give this back to you.
Thank you, Knipper. All right. I'd like for my Councilwoman Karen Boyce come up and give up she has to say.
Hello, everyone. And yes, I am your council person for Health Center, but today I would like to talk to you about the Health Center Senior Citizens. I'm the director there, and our building is going to remain closed until further notice. We don't know how long that will be, but watch our website and our Facebook page and all of that, and we'll keep you up to date. We are still delivering our home-delivered meals. My home-delivered people are homebound and really need at least one good hot meal a day. So we are continuing that. I met with Jack McCaslin last week on a phone conference, and we came up with a very nice sanitary way to protect our home delivered and our volunteers, and we have already implemented that, and we will continue with that process until further notice. I would also very much like to tell all of our volunteers and anyone in the town of Hale Center that is doing anything for someone else that can't do it for themselves. Our volunteers make our program. If we didn't have them, we would not be able to deliver these hot meals. And it keeps us from going to a shelf-stable meal every day, and I'm so appreciative of every organization and every single person that delivers our meals. We just couldn't do it without you. So continue to make something, do something, or make a phone call or write a note to someone that you know that's really lonely and needing some special attention. Our seniors, some of them are in awful lonely situations, so reach out to some of them, see what they need, see if you can help them in any way. Thank you, and be safe.
Thank you, Councilwoman Boyce. I have one other deal that's sitting out in the audience. Mel, would you like to say anything, or do you like to?
No, I think all my answers were.
Okay, your answers are already answered. Okay, glad to have you here, though, and I'd like to just say let's just continue on our community seniors 65 and older, and I'm asking for everyone help to control this virus in our small communities. I would like to see everyone with masks, from children to adults, if you must leave your home. And then I'm gonna ask Terry. Terry, you like to say the last deal? All right, thank you.
Thank you, Mayor, and everybody that has viewed this and everybody that took part in it. As for our church, Jerusalem